How do we protect ourselves from the harmful effects of X-rays? Today in Physics Explained, we present to you the different uses of X-rays, the risks of exposure, and ways to protect ourselves from its harmful effects.
X-rays are a type of radiation wave called electromagnetic waves, discovered by Wilhelm Röntgen, a German physicist in late 1895. X-rays sequentially benefited a spread of fields, most of all medicine, by making the invisible visible.
Due to its ability to penetrate certain materials, it is valuable for diagnosis and non-destructive testing of products for flaws and defects. The most common use for X-ray is imaging portions of the body such as bones and teeth. They can also be used in cancer therapy, in which the radiation is directed against cancerous cells in the hopes of destroying it.
Another technique for using X-rays is producing what are called CT scans. X-rays are also often used by chemists to perform non-destructive elemental analysis. In the industry, X-rays are essential for security transportation, inspection of cargo, luggage, and passengers.
While exposure to X-rays does provide benefits, there are also risks to consider. The risks from X-rays come from the radiation they produce, which can damage living tissues. The risk is relatively small, but it increases with cumulative exposure.
X-rays can cause mutations in our DNA and therefore might lead to cancer later in life. According to a study of Dr. Faisal and colleagues, their results indicate that in the UK, about 0.6% of the cumulative risk of cancer to age 75 years can be attributable to diagnostic X-rays. This percentage is equivalent to about 700 cases of cancer per year. In 13 other developed countries, estimates of the attributable risk range from 0.6 to 1.8%, whereas in Japan, which had the highest estimated annual exposure frequency in the world, it was more than 3%. For this reason, X-rays are classified as a carcinogen by both the World Health Organization and the United States government. Still, the benefits of X-ray technology far outweigh the potential negative consequences of using them.
The summarized results of Wang Suna and others showed that high doses of radiation can cause side effects. Short-term side effects often include nausea, vomiting, diarrhea, bleeding, loss of skin and hair, and low blood cell counts. There's also a risk of long-term side effects. Radiation can weaken bones so that they are more likely to break later on. Radiation to the bone marrow can lead to long-term problems with blood cell counts and even a disease called aplastic anemia. Radiation can also lead to infertility, problems getting pregnant, or fathering children. However, lower doses of radiation, such as from imaging tests, are not known to cause short-term health problems.
The increased risk of cancer from exposure to any single test is likely to be very small, but the radiation exposure from all sources can add up to over one's lifetime, so imaging tests that use radiation should only be done if there is a good medical reason to do so.
For this, there is an acronym ALARA that stands for as low as reasonably achievable. The point of ALARA is to minimize radiation exposure. A small dose of radiation that has no related benefits should be avoided. No matter how small the exposure, radiation workers and patients can control and limit their exposures to penetrating radiations by taking advantage of time, distance, and shielding.
By reducing the time of exposure to a radiation source, the dose to the worker or patient is reduced. If you minimize the time spent near the source, the dose received is minimized. When appropriate, increase the distance between you and the radiation source, for example, a sealed source or X-ray tube. The third exposure control is based on the proper radiation shields, automatic interlock devices, and in-place radiation monitoring instruments, some temporary or portable shields, protective drapes, lead or lead equivalent aprons, and accelerator.
If you are still concerned about the risk, talk to your doctor before the examination. According to the Environmental Protection Agency, the best way to protect yourself is to make sure the technician performing the procedure has the proper qualifications and to simply ask questions.
It is very important to be educated on the harmful effects and weigh the consequences in order to make smart and responsible decisions for your safety. Take note of the ways to protect yourselves from the harmful effects and set up a good example for the community. This is Physics Explained. Till next time.